The number of teenage mothers increased slightly from 90 in 2024 to 130 this year. This is based on the final number of babies delivered on Christmas Day in public health facilities. The National Health Department says a total of 1,668 babies were safely delivered on Christmas Day compared to 1,360 babies delivered during this time last year. Gauteng recorded the highest number of newborns at 428 babies. But what can be done to protect young girls from falling pregnant? And is enough being done to teach teenage girls? To talk about this, we are joined by the Commission for Gender Equity spokesperson Javu Baloyi and Lebogang Motau from the Free World Initiative. To both of you, good evening and thank you so much for joining us on the late edition. Perhaps to start the conversation is just to get your overview. Lebogang, perhaps I'll start with yourself as what you see as the most urgent driver of teenage pregnancy in our communities and how that is linked to gender-based violence and power imbalance. Lebogang, I hope you can hear me. It looks like Lebogang cannot hear me. We'll try Javu in the meantime. Javu, how would you characterize the current state, especially when you look at the number that has gone up? And what do you think is one of the biggest driver that is driving teenage pregnancy in our communities?
Thank you very much, and greetings to the viewers at home. The numbers are worrisome to such an extent that it points a bleak picture to the girl child who's falling pregnant year in, year out, and because of the situation, some of them beyond their control. What's needed, it's the insourcing of responsibility by society and parents at large. We have got this scenario in which, as parents, we believe educators will do everything for us. And it's scary. When you look at the report from the Commission for Gender Equality, which looked at the teenage pregnancy and the strategic engagement with province, you realize the approach thereof that seems to negate the responsibility by even community leaders, everyone involved. You know, you look at the provinces, you see that, you know, we are failing the teenagers by not talking enough about the scourge of teenage pregnancy in our country.
Yeah, I hope Lebogang can hear us now. Lebogang Motau, I hope you can hear us now to join us into the conversation. I wanted to find out from you. Good evening and welcome. Thank you so much. I wanted to find out from yourself about the disproved argument, disproved, and I say it with that word underlined, of that some girls who particularly come from poverty-stricken homes opt to fall pregnant so that they can access things like child grants. Could this be true or be a factor from what you have experienced and maybe the number of girls that you have had contact with?
I think it's absolutely amazing that you have stated that it's disproved. So often we use that as a reason not to look at the real factors that are causing these teenage sexual assaults. We need to, first of all, stop calling them teen pregnancies, because a child who is pregnant beneath the age of 18 could not have consented. Therefore, that was already a violation in itself. Sure. There is inequality, there is poverty, and those are driving factors towards why all of these pregnancies are happening. But we need to realize that the grant is so small, I don't think anyone would destroy the rest of their lives for something so insignificant and so small. We actually need to start tackling the real issue, which is inequality, which is poverty, which is the fact that older men are perpetrators and there isn't enough consequences for perpetrators. We keep putting this on women and children to keep themselves safe, yet the systems are not in place to ensure that girls are kept safe.
Yeah. Javu, the Commission has highlighted barriers that stop teenage mothers from returning to school. But what concrete accountability measures do you think we could get from schools and parents, government departments, so that pregnant learners and young mothers are protected and still kept in school and not further victimized?
One of the things that Lebu even said also, We need also to bring to bear the issues behind it, some of these issues that are preventing the girl child to go back to school. Us men who are perpetrating a stage of teenage pregnancy should also be made to be accountable. That's number one. Number two, also, we need to sensitize learners throughout the provinces, throughout the education system, that it's not a fault of a girl child to fall pregnant. Some of them, they have been raped by their own family members. Some of them have been raped by their own fathers. Some of them have been raped by stepfathers and some elders in society. And when they go back to school, the stigma is left with the girl child. Some of them, you find that it's an educator who has done that and pay off the families, like we've seen in some provinces. What we need to do is more education, more awareness, more during life orientation. There's supposed to be greater engagement with the educators for them to understand some of these issues so that we do not make them feel like, less of human beings. Yet it's someone out there, and the life of this man, and it mostly continue, and yet the girl child is made to suffer the consequences.
Yeah. Lebogang, let me bring you in now and talk about the research and government reports that show that poverty and older sexual partners, you have slightly alluded to this, and coerced sex as well as high levels of gender-based violence are obviously the key drivers of teenage pregnancies. But what practical interventions can we use in our homes, firstly, in schools, secondly, and in communities at large to shift the scourge and protect girls before they fall pregnant? Javu has mentioned the issue of education, but surely there's more that we can do, the three of us, that we can do. We know young girls in our midst. What can we do that is practical? Lebogang, I hope you can hear me.
I think we'll put Javu, hear me?
Yes, we can hear you. You may continue.
Okay. So you hit it on the head. And I think the first thing starts off with media, because media and social media has glamorized sex and has glamorized the interrelationships amongst the blessers and the younger children. We've glamorized your transactional relationships and that type of stuff. So let's start it off with media, because media plays such a big influence in our children's lives and in our lives ourselves. Let us change this narrative. This is not teen pregnancy. This is gender-based violence. This is sexual abuse. Let's start off with that. Let's enforce statutory rape laws. We've got amazing policies. The government is doing amazing in terms of what we're putting down in paper, but then the enforcement is not happening. Javu did mention that. Why are we not investigating who are these fathers? How are we keeping these children safe? How are we making it safe for this child to report? How are we ensuring that this child has got friendly services when they're going into a clinic? If they are choosing to be sexually active, although we do need to push education, to push abstinence above everything else. That's the safest thing you can do. Our ABC and D for delay the debut of sexual intercourse. We need to start imposing that and implementing it at a younger age. But what are we doing when we find out that these girls are pregnant? Are we investigating? I was happy to hear the interview where the MEC actually said that they were going to include justice and the Department of Social Development. But let's work together. Let health, the education system, the justice system, social development, all come together to ensure that our young girls are in a safe space at schools. Let us now also, something that FWI Free World Initiative has been pushing for, that perpetrators register needs to be put out. We need to know that our children are in safe places with safe people. So, of people who are working with children. Those are things that are high on the list. Economic support for the girl child, skills development, because a lot of this is based on dependency and wanting to survive. Girls are getting into relationships with older men for survival. It's not necessarily a glamorous thing to do. So how do we make sure that this child has got the ability to get themselves to school? Removing period poverty is a huge drive for these type of things. So education, enforcement of laws, following up in terms of the perpetrators, and making sure our girls are safe. We are failing the girl child. It's not a moral dilemma. This is a societal issue.
The following question, I would like to give you both turns to answer it. This is surrounding the issue of free access to things like contraception. And of course, as Lebo has just mentioned, sexual education, we have that at schools through LO. But how can we incorporate both these into current religious cultural practices, you'll remember that in the rural areas you still have the issue of, or not the issue of, but organizations that encourage girls to stay pure for longer. And also you have in churches, for instance, where pastors and religious leaders are encouraging abstinence from sex before marriage. Yet the reality is that these girls will still step out, some of them, and will still be get pregnant in unfortunate circumstances. How can we incorporate the issue of contraception and safe sex, if you do eventually have it, or using it to abstain completely to keep these girls safe from early pregnancy? Perhaps, Javu, let me start with you. Lebo, please go right ahead after that and give me your views.
Thank you very much for that wonderful question. The issue, the reality of our society is that no culture or religious or traditional issues which are not in line with the Constitution of the Republic of South Africa should be promoted. We need to be visible for us to say, this is the life of a girl child that is at stake here. We need also to look at how culture and religion, because some of these pastors that based on the statement that the Commission have raised, reported on, they're the ones that are preying on these young kids. Some of the cultural practices that are being done, they're harmful to the girl child. We need to, when we have condoms in the hospital everywhere around the country, yet we don't have free sex education and contraceptive. And also the healthcare workers at times, they play a very, very huge role insofar as ridiculing the girl children when they go to some of the clinics. And some of the clinics are very far-fetched. We need mobile clinics that are there, and we need community development workers to be with the communities to understand some of these kids are introverted, they cannot speak up. And if we do that, I am telling you, we are going to raise a girl child that is okay with issues, that is capacitated, that won't be taken advantage of. Yes, they can make them remain virgins for long, but they also be exposed to dangerous world, which is ours, where they can be raped, where they can be coerced, where everything they can be also spiked, that drinks can be spiked and fall pregnant. But when the contraceptives are there available, freely available, we can somewhat avert the situation where a girl child drops out. You know, next year you will hear a lot of girl children pregnant because we are oblivious to the fact that, you know, as if these things are not happening in society. We need to restore the values of Ubuntu and community welfare in order to avert the situation. It's a pandemic as it is.
Yeah. Lebo, please take over, and I'm keen to hear your views.
But Javu, I'm just clocking it, as my daughter would say. A lot of the things that you're saying are absolutely correct. We do need to put the blame where it's needed. We are so focused on the girl child and what the girl child has done and teen pregnancy instead of focusing on our perpetrators. We are shying away from the fact that it's the same religious bodies who are the perpetrators of this violence. We groom our children as parents from a very young age that if like give him a hug. That's how we actually teach our children to be perfect victims, because we tell them that they cannot argue with adults. We need to start teaching our children from a very young age to be able to say no to an adult, to be able to speak up. As parents, we should be the first point of education for our children. It is not at the school, because that could be a perpetrator. It's not at the church. We need to take back a parenting to ourselves and teach our children that it's no longer stranger danger. Now we need to teach our children that there are some adults who are unsafe, and what is safe and what is not safe. Keeping secrets is not safe. Any adult who makes you keep a secret is not safe. Opening up those conversations about consent, opening up the conversations about sex, opening up these conversations. And what you were touching on as well, Javu, about the health-friendly services. For years, the Department of Health has been trying to work on this, but still girls are going there and being turned away by our nurses. We do need better training for our nurses to be able to communicate with our children who are already choosing to be sexually active. Let us as parents take it back. Let us as parents be a safe space and an open space to open up dialogue and be able to communicate to our children. But also as adults, can we be a safe space? Children should not be changing how they dress or where they go. We as adults need to be safe. We as adults should not be hitting on a Ben 10 as we think is so cute, or as an older man having a younger girl. Those are cultural ideas and practices that are perpetuating this violence against our young children, and these children are found lacking, and we are the issue as adults.
Both of you, I have less than 30 seconds left, but I need you to address a girl child that's watching Late Edition right now with just one short sentence with the one powerful advice that we'll close it with. Javu, I'll start with you.
To the girl child out there, we are saying as a Commission for Gender Equality, take this number 083-284-2567. It's a WhatsApp number. If you are turned away from the clinic, if the police do not help you when you're faced with trouble, the Commission for Gender Equality is there. Please be safe out there. Do not be trusting. Open up, talk to someone in the family if something has happened. If they stop you from talking as family members, you have got our numbers as a Commission for Gender Equality. We are there in all the 9 provinces. We shall help you.
Thank you, Javu Baloyi from the Commission for Gender Equity, and Lebogang Motau from the Free World Initiative. Your killer advice to a young girl watching us.
We want to tell you that your body is your body, and no is a full sentence. Thank you for having us.
Thank you so much to both of you. It really has been a fruitful discussion. Thank you so much for your time.